Welcome back. Thom Hartmann here with you. Remarkable. The Chiron on Fox News right now. White House answers previously asked reporters' questions. Right on MSNBC, it's White House defends Trump's tweets. Oh man, and Ann Coulter has come out and said, "Hey, with this tweet where Trump is talking about Mika Brzezinski, I like Trump again." Hannity is defending it. Joe, you lie, deadbeat dad, Joe Walsh, he's defending it. It's rather bizarre. So, Tom, in Reading, Pennsylvania, it says here you disagree with me, so you go to the top of the pile. What's up?
Yeah, I'm from Media, Pennsylvania.
Mm-hmm.
Okay, and I do disagree with you. I think the costs of a single-payer system are just going to make it unfathomable for the middle class, because right now you got 150 million people. Now they get their insurance basically through their employer, and 55 million you have on Medicare. Now Medicare works because you pay into it through a payroll tax many, many years before you're eligible for it. And I think if you go to a Medicare for all system, that the 150 million now that like their health care, they're going to be put in the same pool of, I guess I would say, mediocre service for everybody, mediocre health care. And you would have to really reduce the costs, I think, and salaries not only of doctors but of the nurses, the technicians, the unionized orderlies that work in the system. I think that the costs for someone, say like me, who has health care I'm happy with, and there's far more people that are happy with their health care than there are that aren't. So, maybe you would want to go with a Medicaid system for those that can't afford it, and then buy-ups.
Yeah, well, Medicaid and Medicare are both single-payer health care systems. It's just that Medicaid is funded out of general funds, and Medicare is funded out of the Medicare Trust Fund, which is paid for with FICA taxes and also with the fees that once you're on Medicare you pay, whereas once you go on Medicaid, you don't pay that monthly fee like you do with Medicare. But, Tom, let me ask you a question. Why do you think it is that Walmart can offer lower prices to consumers than the local mom-and-pop shop?
Several reasons. Number one, they get cheap goods, they buy in quantity, and they have real nasty strong-arm tactics to get people to sell them their product, or they're pretty much out of the market.
It's buying power. It's buying power. It's because they're buying for probably 600-700 stores in the United States. I don't know how many they have, but a bunch of them. And instead of buying 100 pencils, they're buying 100,000 pencils. Instead of buying 20 bicycles, they're buying 20,000 bicycles, and so they can negotiate a lower price. That's the advantage of a single-payer system. Medicare is a single-payer in terms, they're a single purchaser of stuff that gets resold into their retail store. Excuse me, Walmart is a single purchaser of stuff that gets resold in their stores. And similarly, this is why, while we pay in the United States $8,200 per person per year, that's men, women, children, everybody, right, for health care, in Norway, the next most expensive country in the world, they pay $5,300 because their single-payer health care system is able to negotiate on behalf of all 20, 30 million, however many there are people in Norway. They can buy on behalf of all of them.
Yeah, doesn't Medicaid negotiate? Haven't they negotiated terms so, shall we say, favorable?
Medicaid is not anywhere near as successful as Medicare. Medicare is a federal program, and it's nationally administered. And so Medicare actually operates with a 3% overhead, and their overall costs are dramatically lower than any health insurance company. In fact, the health insurance companies kind of ride on the back of Medicare. Medicare sets up the purchasing standards, and a lot of the health insurance companies say, we will only pay what you pay Medicare. Medicaid, on the other hand, is administered individually by the states. So every state has their own Medicaid program, even though the federal government, with the Medicaid expansion through Obamacare, is giving money to the states to fund their Medicaid programs. It's still state by state. So you've got 50 Medicaid programs. You've got one Medicare program.
I would say Medicare also works because, when you're working, you pay a payroll tax, and so does your employer, and you're paying into it many years than you do when you retire. So basically, it's trying to do what Obamacare does: have healthy people pay in it, before they
right.
really
I agree.
need it.
I agree, but the way that Norway and well, basically every other developed country in the world, the other 35 of the 36 developed countries in the world, the way that, arguably with the exception of Switzerland, which does it as an entirely nonprofit system, but the norm among civilized and developed countries is that everybody's taxes go up a little bit, particularly very, very wealthy people. And in exchange for the and then you also actually buy the insurance policy. It's I don't know the exact numbers. I've had callers tell me that in Canada, we had one caller say that for his family it was $140 a month for access to the single-payer healthcare system. We had a caller from Mexico who said it was $120 a month to access the single-payer healthcare system in Mexico. But typically, you have to also pay into the system. And so that does the same thing as the payroll tax with Medicare. Although, it's not accumulating on the front end. I get that.
You don't pay anything into the system. Is that not correct?
I'm sorry, say that again?
If you have no income or a very small income, you're going to pay little or nothing.
That's correct.
So therefore,
that's correct.
There's going to be a huge shift in costs here to the middle class if you get Medicare benefits rather than Medicaid, because now you're going to get Medicare benefits with, probably because they can't afford it, no co-pays, and they would have to say maybe you don't get the single room in a hospital that I get with my insurance now. I think people that have good insurance that they like now are going to either have to pay more for it or get much less quality of service, because
this is how it works in all these other countries, Tom, is you get, you can call it mediocre service. I'd say in the United States we have something worse than mediocre service. Particularly just having gone through back surgery, having to wait literally weeks in excruciating pain just to get a doctor's appointment. And I had to go through like 4 different specialists before the surgeon would actually do the surgery. And every one was, you have to wait another month. I ended up waiting a total of at least 4 or 5 months to get this surgery while I was in pain, while I was, taking drugs for pain and trying to do a talk show. And it was nuts. We've got you talk about mediocre health care. It's happening right here in the United States.
See, that's not
but what happens and by the way, those kind of waits, by and large, don't exist for people who are actually in acute pain in most countries that have single-payer health care systems. But in those countries, you will find insurance companies. And those insurance companies say, hey, if you're wealthy enough, for an extra $1,000 a month for a health insurance plan, we will guarantee you a single bedroom rather than, a 2-bedroom thing. We will guarantee, we will fly you from anywhere in the world. If you want to pay $5,000 a month, if you're really rich, we'll guarantee you, catered meals with 5-star cuisine that's all organic there are some really absurd programs out there that you can find in some of these European countries.
And would support that in this country then, even if it means you'd be jumping ahead of the line?
I have no problem with rich people using their riches to get whatever they can get, right? It's as long as it's not hurting the rest of us.
Well, that's what they would say. If you're jumping ahead, you're hurting the rest of us. I know Canada has a deal where you can only insure for services not given to the general public, so you can't decrease.
That's correct. In fact, Canada, up until about 5 or 6 years ago, had banned private health insurance, and then they changed it so that. But by and large, what those private systems are paying for is actually not. You're not jumping ahead in the line of everybody else. You're jumping into a whole separate system. There are private for-profit hospitals. There are concierge docs. And this is actually exists right here in the United States right now. It's just, there's concierge doctors in this town. There's concierge doctors all over the country, who you pay a couple $1,000s a year to, and they limit their practice to 100 patients or 200 patients or something like that. But,
and I'm a middle-class employee. With the railroad, I've got good insurance, which we sacrifice wages and benefits for. I've never had the experiences that you have. I don't know what kind of insurance you've had, but I've had elective surgery. I've had.
It wasn't my insurance. It's that I live in Washington, D.C., which is this incredible boom town. And, when we first moved here, Louise couldn't find a doctor, and she has to take, this thyroid thing for her thyroid. Every doctor said, go to the ER. It took 6 months to even get a doctor in this town. It's nuts. Tom, I got to run, but thanks for the call.